Hello and welcome to the third episode of the Connect the Dots NYC podcast. I'm your host, Vedant Vohra, and I'm so excited to take you on this journey as we explore different solutions to homelessness. As the creator of the CTD NYC app, I've seen how technology can connect people to vital resources. CTD NYC helps individuals experiencing homelessness in New York City access shelters, food, and healthcare, bridging the gap between them and essential services. It's a powerful example of innovation meeting compassion to tackle the homelessness crisis. Each episode in this podcast, we dive into stories, strategies, and innovations from those on the front lines, whether they're advocates, policymakers, service providers, or individuals with lived experiences. My goal is to spark meaningful conversations and shine a light on the incredible work being done to make housing more accessible for everyone. Thank you for joining me today, and let's get started. Our guest today is Maria Ortiz, a seasoned social worker and advocate with almost 2 decades of experience in human services, specifically in the areas of child welfare, behavioral health, and community engagement. With advanced degrees in forensic psychology and social work, Maria has served in impactful roles, including as a forensic social worker at the Legal Aid Society and psychotherapist at Ryan Health. She's an active leader in civic and professional spaces, serving on Manhattan Community Board 4 as co-chair of Housing, Health, and Human Services. Through her clinical expertise and commitment to serve others, Maria advances holistic, community-centered approaches to social justice and behavioral health. Welcome, Maria.
Thank you for having me this morning.
So I want to get started with your personal journey and the motivation behind your career. So what inspired you to pursue a career in social work, specifically focusing on housing and mental health?
Where do I start? When I look back at my life, my goal was not to work in mental health or be involved in the areas I'm involved in right now, being on the community board, working in the community, being a therapist. But when I look back and I reflect, it makes sense that I probably am in the fields that I'm in when I think about my own experiences growing up in this community, growing up in Manhattan Community Board 4. I grew up in Chelsea and Hell's Kitchen my entire life, and thinking about growing up in living in poverty, we experienced some homelessness, seeing the impact of mental illness in my family, as well as substance abuse, specifically alcohol, and seeing the impacts of that and how it impacted my family and our stability and our well-being. I think that is what has led me to where I am now, and really valuing and understanding the importance of mental health and housing stability. I mean, and something else that I really value is education, but I think that's just part of my mother always kind of saying that I had to finish school and go to college and have better and do better. The other thing too that I think has impacted me, impacts many people, is trauma. Has led me to where I am today, I think. All of that. The good and the bad. I just mentioned more negative things, but I think that is really what has helped. And I guess I should, to wrap it full circle, I think despite all those challenges that I just mentioned, there were some things that were kind of consistent in my life. And that was like my grandmother being present, who lived at Elliott Chelsea houses. My grandmother kind of being present for us when we were children, and my mother couldn't really do what she needed to do as a parent, and other family members as well. Also, I think being involved with human services or social service agencies in the community at the time. And we had our own social worker who was working with us. Harlem Children's Zone? You've heard of them?
Yes. Yeah.
Okay, so they used to have an office in Hell's Kitchen. It was called Read Them Place. And so that's how we were working with the organization. And um, I think that that really was impactful. And my mom was doing really well for a significant period of time. And I think that impacted me more than I realized because I ended up doing similar work.
And so, what's something that you wish more people understood about these lived experiences of those who navigate housing insecurity?
I think something that others need to understand more of, be more aware of. I would say, I think there's so many layers to that question, the way I could answer, but I think the impact of struggling with serious or even mild mental health issues, the impact to the family, the ripple effect that it has. I think also uh, trauma, and trauma could be many things, right? I mean, even experiencing growing up in a household with somebody who has severe mental illness is considered, can be traumatic. So, um, but thinking about, or growing up in poverty, that can be considered trauma. But I think the the impact of mental health and well-being in terms of how it impacts every area. It impacts your ability to go to work, your ability to interact with others well, your ability to, if you're in school, maybe focusing on classes or doing well in school, um, which can have another impact in terms of even like stability of housing, right? So it's the importance of it. I think many people get it, but I think to answer your question, that's what I would say.
And how has your work across clinical, legal, and community spaces changed your perspective on justice and care?
Mm, I guess I would say, mm, I think it's allowed me to see the flaws in the systems that exist, um, and there's a lot of them. And how to make change. It's not really one person. It has to be a collective. It has to be, or a coalition, um, and how difficult sometimes change can be, even if it is change for good. Um, and I would say it's allowed me to have respect for people who are in the work, doing the grind every day. For example, like electeds or people, electeds, we see their face, we know them, we vote for them, right? But there's people who work with electeds who also help to make change and are like boots on the ground kind of folks, meeting with people and um, just all of the organizing that goes into um, creating change and making change, because really it's not easy and you really have to persevere. So having respect for people who do that kind of work.
And so, I want to shift a little bit towards your professional role. What does a typical day look like for you in your role at Ryan Health, and how do you approach integrated care?
Um, so my typical day at Ryan Health is really providing psychotherapy to people all day. Um, and um, the psychotherapy that I provide is um, the issues that are less serious. And I say that not to minimize someone's experience, for example, of struggling with depression or struggling with anxiety or trying to figure out what it is they're actually struggling with, but they're not sure. Is it ADHD? Is it autism? Is it anxiety? Like, Maria, I don't understand what's happening here with me, but I know that this and this and this and this is happening in my life, and I don't know what to do or what it is. And um, so, but for example, so at Ryan Health, I work in BHI, which is the Behavioral Health Integration Program. Orion Health also has an emotional wellness program, but emotional wellness, they deal with they're considered an Article 31, which I believe is Social Services Law, Article 31. And they deal with mental health issues, for example, schizophrenia, um, folks who have bipolar disorder, right? The more serious kinds of conditions um, that require more care, more intensity. Um, where what I'm dealing with is considered Article 28. And so that's why I deal with certain folks that don't require as much care. They may not need psychiatry. Usually they don't. And I think the integrated part is really helpful because I can speak to the primary care physician of the patient. The primary care physician can speak to me about what's going on or how things are going. Also, because, when someone's struggling with something, one of the things that's really important when you have someone come in, let's say, and they're talking about they're feeling really depressed lately and they have some symptoms of depression. Okay, is it really depression or is there, for example, a thyroid issue? Are they getting a physical? When was the last physical? Right? That's important to know. And so having that integrated approach, I think, is really useful and helpful in terms of treating someone in a holistic kind of way.
And how does your experience as a forensic social worker inform your current work as a psychotherapist and advocate?
Um, well, first, usually when people know that that I have a bachelor's and a master's in forensic psychology or that I was a forensic social worker, often the question is, what is forensic social work? And I just describe it as when you think of the word forensic, think of it being related to the courts, whether it's criminal court, it's family court. I used to do, because of child welfare, I was in family court. Sometimes there was a crossover and I'd have to go to criminal court, to special parts or special courts where there's judges who just handle specific kinds of cases. It just makes me more informed. I'm more knowledgeable than like the average social worker. If they haven't worked in child welfare, like I understand the court process. I know um, how difficult it can be to have a case in family court or have your children removed in because the court process is so slow, right? And there's delay after delay and then having to deal with several agencies. So it just makes me more informed, more empathetic to listening to someone's story about what they're struggling with, whether it's at work or on the community board and someone's talking about the court process a little bit. I can understand their frustrations. I think that's how it can help. And also, it allows me to, because of my experiences in court, it allows me to really remind my patients the importance of having representation. You have to have an attorney. And here are some resources for you to find one. There's one in the neighborhood, or here you can call this number and get free legal advice before you even get to court, even before you file a petition. So I know some of those resources, and that is helpful.
And you mentioned your work on Manhattan Community Board 4. How does that platform help amplify housing and mental health issues?
I think it gets amplified when there is political will to amplify. Okay. Or when someone has personal experience and they are amplifying their story. And then that's where I think it has a better platform. Or unfortunately, and specifically right now, I'm thinking about mental health. Okay. Or unfortunately, if there's a tragedy that occurs. And then you hear more about that. When it comes to housing, housing is a citywide issue, national issue, and so that's something we always hear about. In fact, in Manhattan, there's 12 community boards. If you look at, so every community board, every year we have to put together a statement district of needs. And those are the things that the community board sees as most necessary in the community. Almost every community board in Manhattan has the top issue as housing. And if not the first issue, it's one of the top three. But most have it as number one. Okay. So I think, and if affordable housing is being put into a community, it has to go through the community board, because the community board is like, I would consider it, I would explain it as like the lowest form of government. Like you have the mayor, you have the commissioners and heads of different agencies, you have a borough president, district leaders. And anyway, the point is that I would say it's like the lowest form of government. So if we're going to have something in the community, they have to come before the community board. With mental health, that's not something that often comes before the community board. It depends on the organization and what they need, or if an organization is doing a certain initiative or they are new to the community, they can come to the community board and talk about it, or ask for connections or collaborations in the community. The community board is really a really good resource if you're trying to collaborate or get to know people who live in the community.
And in your profession of social work, what does impact mean? How do you know when a program or approach is truly working?
In social work, the first answer that comes to my mind is actually research. Through research or program evaluations. When I was in school, I actually liked research. But that's how you can determine, and that's how like funding is determined. Currently, like, okay, if we're going to continue funding this program, is it working? Let's do some program evaluation. Let's see if it's still working. Let's run the numbers, blah, blah, blah. I think also how you know it's working is the quality. So that's considered running the numbers, and like that technical kinds of research is quantitative. But there's also qualitative that's important, and that's like talking to people or focus groups. And or another simple word is like feedback. That's how you know if something is working. You have to talk to the people. What do you think? Like even in therapy, sometimes I really need to do this every session. I don't do it every single session that I have with a patient, but sometimes I need to get feedback. Like, what was helpful in this session for you? Do you think that there was anything that's not working, or what would you like to do more of? How are you feeling? Do you feel like from the start of therapy until today, there's been some progress? So it's really just, I think I would say, getting feedback. But also the other part is the research or program evaluations.
And on that note of receiving feedback and also in your profession of being a therapist, can you share an example of a client or a community win that really stayed with you?
There's lots of them. I love what I do, and I've been fortunate, glad that I have so many patients that I'm able to say that things change for them. Small things change for them in their life. For example, when they're able to change their negative self-talk, or instead of giving themselves a hard time, for example, messing up on something. Oh, I'm such an idiot. I'm so stupid. I can't believe I did that. Versus, I made a mistake and that's okay. And it doesn't happen that quickly. Like there's phases of what the self-talk or healthier self-talk looks like. And it might start with, hey, that's not really nice to say to myself, or stop, just stop. Okay. And then maybe having a different thought. But the point is that the phases of it and hearing those stories, which are fabulous, and hearing how people feel a sense of relief or they feel better, that's really, or not so terrible about themselves. That's really important. And I love hearing those stories. That's quite a bit of them. And something in the community, like on the community board, one of the big things, well, there's two big things. Well, can I mention three? One of the big things that I'm kind of excited about and I forget about, I was excited about it at the time, was when I was the PTA president, a PTA co-president at PS 111. And one year we put in a request for discretionary funding with the electeds, because sometimes you can vote on discretionary funding for different projects you want in your community. And we had that. And we put in something, my co-president and I, for money for air conditioners in the school lunchroom, which was like almost $500,000. And we got it. That was a really big deal. Okay. And what was the other thing? Being on the community board, I would say Hartley House. Hartley House is a nonprofit. It's like kind of like the Hudson Guild or Henry Street Settlement, like a settlement house that's in the community, does lots of different kinds of services for people in the community, that has existed for a long time. And Hartley House, they were going to be closing. This was before COVID, that they were going to be closing, but they came to the community board. The local elected got involved at that time, a couple of local electeds, and ultimately, because of the collaborations and political will, it was saved, right? So it's not shutting down. In fact, what they're doing is just changing their model a little bit. So there'll be affordable housing located there. Hartley House is on 46th Street, West 46th. And then another thing that was exciting. Oh, and with Hartley House, I've never seen something occur so quickly. Okay, so, but I think part of the reason that occurred the way it did, it was because of political will and the electeds really being involved and gung-ho about it and using their resources in the community to help with this project, right? And so the other big win, I would say, was Bayview, the Bayview project. It's going to be called, well, the name supposedly is going to be Liberty Landing. It's on about 12th Street and 12th Avenue. It's in Chelsea. And if you look it up, you can see that what it's going to be is, and this is something that was really exciting for me because it's something that sort of came out of Community Board 4, Housing, Health, and Human Services, and us talking internally about it. And then it became a reality. And it's going to be a building that is approximately like 125, maybe more, housing units, affordable housing units. Some of them are going to be supportive and some are going to be, it's called short-term transitional housing, and there'll be social services on site. There's going to be community facility space on site. And that was something that if you do some reading or research about it, you can see that was Governor Hochul was behind that, I would say. So I think political will is really, really important in terms of getting things done. And your question was really about like the wins, but those are some wins.
I want to shift a little towards the challenges and barriers that exist within our society. And so, my first question is, what are some of the biggest systemic challenges that you see in supporting individuals facing both housing and mental health security?
I would say the biggest challenge is if there is not political will to help move certain initiatives along, and or a lack of funding, a lack of the resources. You need money to make things happen. I mean, you can't hire people, you can't create um, the housing, that's required, that's needed. You need money, but also the will, especially when it comes to helping people who are less fortunate or who are on the lower end of the socioeconomic status, people of color, when it comes to mental health and funding, or when it comes to affordable housing and funding affordable housing.
And what do you think are the hidden or overlooked contributors to housing instability in New York City?
Um, well, I guess if I would say hidden or overlooked, maybe like I struggle with this a little bit because I think the issues, the reasons why people already know. But I would still say low wages, high rents, um, when there's domestic violence in the home, when there are substance abuse issues in the home, um, mental health issues, poverty, um, and especially um, with concentrations of poverty. I think all those things contribute. Um, I don't know if they're all overlooked. Maybe some of them are. But the other thing is that there is like a coalition, the National Alliance to End Homelessness. It's a good way to get to hear ideas because, this country is big and there's lots of initiatives and lots of things happening in this country. It's not like we need to reinvent the wheel for anything. There are several solutions to how do we fix this one issue. There's several ways to get there, right? But like maybe hearing the ideas, maybe it means a mix of ideas.
Yeah, that sounds super interesting.
Yeah.
In your experience, where do support systems most often fail people in need and why?
Where do they fail people most in need? Hmm. I think I when I think about it, if people are failed in a certain kind of system, my assumption is like what I would go with, or what I have seen sometimes actually happening, or that I've experienced, is when you're interacting with somebody who doesn't really care about the work that they're doing, or someone who doesn't understand where they work, or the rules, or the regulations, or the policies, or the things they can do, and thinking they're not able to do something. Or someone, when I say who doesn't care, they know they can do certain things, but they're not willing to do it, or they're not willing to help, or work the extra 20 minutes to help assist someone. Um, that's the first thing that comes to mind. I'm sure there's more that I'm not thinking of. That's what I would say.
I want to shift a little, though, to the social system and collaboration. And so, what role do you think local governments, nonprofits, and clinics play together in addressing mental health and housing insecurity more effectively?
Um, I think working together and collaborating, that's how they do it. And it does happen. It happens already. For example, like where I work at Ryan Health, the one in Hell's Kitchen, Ryan Chelsea Clinton, it's called. They have a collaboration with, for example, Fountain House. Fountain House serves people with serious mental illness. So there's that collaboration. Our um, our local electeds know very well about Ryan Health. They've shown up for different kinds of events, come to speak, or come to provide one of those literally those large checks that you hold and they're like humongous because they've given additional funding to Ryan. But I think that's how things get done, is really there has to be will, there has to be organizing. Sometimes it means the people. organizing together to say, hey, Ryan Health, or to say, hey, Fountain House, why don't you guys do this collaboration? Or, hey, my local elected, Ryan Health or Fountain House needs some funding for this activity or something like that. Can you help us? Let's collaborate. Um, yeah, that's how it's done.
And how do you advocate for change on a policy level through your community board and personal affiliations?
Um, well, for me, I would say the way I do it, advocating for certain things, it can be direct or indirect, right? Um, Directly, I think it's the fact that I'm on the community board. So I already have a platform, but also the, by default, the fact that I'm on the community board, I have access to electeds and to chiefs of staff, um, and able to say certain things or advocate for certain things or ask questions. Or if I have a patient who is struggling with a particular issue, I can send them to the local elected's office and say, hey, say that Maria sent you. Or um, if you want to say Maria sent you, or how do you feel about me sending an email to somebody that might be able to help? What do you think about that? Most patients are open to me trying to help. So I think that's how I do it directly. Um, I think indirectly is when I am just, I was going to say, just talking with folks or shooting the shit, kind of, when you're just talking with people, or when you're at meetings and and I'm making certain points. I feel like that's more indirect, but they're both, kind of interchangeable. But those are the ways that I think I can help.
What do you think needs to shift in the public narrative or political will to truly prioritize housing as a health issue?
One thing that I recognize is that the way in which we function and the way in which laws are changed is often reactive. Even when you deal with the court, whether it's family court or criminal court, the way in which we deal with things is very reactive. In healthcare, it's often reactive too, but in healthcare, you can be proactive. There's things you can do to be proactive, right? To maintain your physical health, to maintain your mental health. But you have to be taught those things. And that's not something that you learn walking into the hospital or walking into the clinic, unfortunately. Um, but uh, what was I trying to get at? Oh, what is required to have more political will for housing to be considered a health? I'm not sure. I think it's just organized. I don't know, because there's already organizing happening around it. There's already coalitions that exist around different kinds of housing, for all affordable housing, right? And so I think I would just say there needs to be political will. I mean, I'm being part of Community Board 4. I remember having a meeting. This is months ago, maybe a year and a half ago. And if I remember correctly, and I could be mistaken, but from what I recall, electeds came to us and had a meeting with us about what can we do to increase like affordable housing, right? And so um, one of the things we talked about is returning certain kinds of programs that exist, like Mitchell-Lamas or Section 8, right? There could be more home ownership that's subsidized, right? I think a lot of things can happen. It's just that there has to be will. And not only from, and when I say will, I mean electeds mostly, but I'm also thinking about like electeds can influence and they have connections with people who have access to resources. And I mean financial resources, like large There could be large donors or large funders for a certain kind of program where there's a gap that we want to create this thing, but there's a gap of whatever, thousands of dollars or a couple of million, and we need some help. We're trying to make this happen. That's just one way. There's other ways that this can happen and occur, but I'm not sure how. Except there really has to be a real desire. And I think one of the big things about City of Yes was it's supposed to create more housing in the city, which would include affordable housing. But one of my personal frustrations of being on the community board is that, and being on Housing, Health, and Human Services, but one of the things that we do advocate for on a regular basis is we care about, we value, we want more affordable housing. And when we have a new development coming into the community, or that's proposed for the community, and let's say it's over 2,000 units, right? And only, let's say, 200 are going to be for affordable housing. That to me is, my personal opinion, that's a little bit egregious. I think that that's ridiculous, especially after some of the research I've been doing around NYCHA and understanding the demographics and the income levels and thinking about affordable housing as a whole and looking up some things around homelessness in the city. It's just frustrating. And I would just wish that we could get more affordable housing in this city. And that would be a priority. Just even if it was just for 5 years, just more affordable housing.
And my last question for you is, what advice would you give to young social workers or students who want to work at the intersection of mental health and housing justice?
Well, those are two big things. My thought is like become an expert in one of them, learn a lot about one of them, and then get involved in the other. But do the thing that you love the most is what I would tell you, because you can go into social work and there's lots of things you can do within social work. Or you get into housing, there's lots of different things you can do when it's related to housing. And some people, I've heard people say to me, but I want to do something where I help others. Doesn't matter where you are. Really, that value of helping others, servicing others, you can be in any role and be able to do that. You can be an administrative assistant and really be helping people. When you care about others, when you believe in others, when you value others, it shows. It pours out of you. It is who you are, and you can be in any role and help others. Just do something that you enjoy, is what I would say. That is where you will thrive and be most successful.
Okay. Thank you so much for joining me today.